Good afternoon, everyone, and welcome to our final installment of your 2026 Developmental Screening Summer Series. Today, we're going to be hearing from Medicaid as it relates to well child visits and screening. But before I introduce our speaker, I want to remind you all of the Bureau of Family Health's Developmental Screening Toolkit. If you are not aware of that resource and have not seen it before, it is a toolkit that provides support for beginning implementation or elevation of developmental screening services. You will find worksheets, videos, and contact information in which we offer individual clinic training and coaching from the Bureau of Family Health staff. I'm going to place the link in the chat along with the webinar evaluation at the end of this presentation, and there will also be a slide with a QR code at the end of the presentation as well. And so this toolkit will help you, like I said, to implement the screening services that are going to be discussed today, as well as strengthen things that you may already be doing and providing. So again, like our other webinars, the evaluation link will be put in the chat at the conclusion of this presentation. So make sure that you grab that link and complete for credit. Now, before I introduce our speaker, again, I want to remind you guys of our disclosure. This activity has been planned and implemented in accordance with the accreditation requirements and policies of TMA through joint providership of Louisiana AAP and Louisiana Department of Health. It's accredited by TMA to provide continuing medical education for physicians. The AAP designates this live and enduring activity for a maximum of 0.5, and physicians should claim only the credits with the extent of their participation. In addition, our speaker today has disclosed that she has no relevant financial relationships, and all remaining faculty, AAP Education Committee members, and staff have no financial relationships to disclose. So that being said, our speaker today is Norma Sagan. Is that right? I believe you just told me. Okay, Norma Sagan is she is an RN program consultant with Louisiana Medicaid, overseeing the state's early preventive services, diagnostic, and treatment, often EPSDT, preventive services program. She was born in Costa Rica, but moved to Louisiana when she was 11 years old and has lived in Louisiana most of her life. She started her career as a psychiatric nurse in 2013, and then in 2016, Norma took a position as a pediatric nurse where she performed well child visits throughout that time. And then in 2018, she joined Louisiana Department of Health, where she managed several children programs, including the Preventive Services Program. Her educational background and love for pediatric leads her to enjoy working with the PSDT population, and she has a degree as an RN in the state of Louisiana. So we are excited to have you, Norma, and I am going to turn it over to you.
Good afternoon, everybody. My name is Norma Sagan. I'm a nurse program consultant with Louisiana Medicaid, and today we will be going over Medicaid key information for pediatric care physicians. Next slide, please. The objectives for today are participants will understand that screenings are performed during EPSDT preventive visits, also called well child checks, in accordance with the AAP Bright Futures periodicity schedule. Intervals outside of EPSDT preventive visits, if they're medically indicated for an enrollee at risk for or with a suspected developmental abnormality. Participants will know how to find the AAP Bright Futures schedule, and they will know what screening tools are accepted. Participants will also know what codes are billed for developmental, autism, and perinatal depression screenings. Effective October 20th of 2025, Louisiana Medicaid retired the type of service 21 in the EPSDT Preventive Services Fee Schedule. This action supports the ongoing efforts to streamline reimbursement structures and eliminate duplication. The EPSDT Preventive Services Fee Schedule codes are now located in the Professional Services Fee Schedule on the Louisiana Medicaid LMedicaid.com website. Providers should reference the Professional Services Fee Schedule for any relevant procedure codes and reimbursement information. In the link on this PowerPoint, this link right here shows the EPSCT Preventive Services Fee Schedule, which is again found on that LouisianaMedicaid.com website. Next slide, please. Louisiana Medicaid EPSCT Preventive Services. Louisiana Medicaid EPSCT screening schedule and guidelines and policies follow the periodicity schedule promulgated by the American Academy of Pediatrics, AAP, Bright Futures, with the exception that Louisiana Medicaid's EPSCT screening guidelines and policies apply to individuals aged 0 through 20. The most up-to-date link to the AAP Bright Futures periodicity schedule is provided below. Next slide, please. This slide is a screenshot of the AAP Bright Futures periodicity schedule. Next slide. Now we'll go over developmental and autism screenings. Next slide, please. Developmental and autism screenings. They are performed during EPSCT preventive screenings. So developmental screenings are performed during EPSCT preventive screening visits, also called well child checks, in accordance with the AAP Bright Futures periodicity schedule at 9 months, 18 months, and 30 months of age. Next slide, please. Autism screenings are performed during EPSDT preventive screening visits, well child checks, in accordance with the AAP Bright Futures periodicity schedule at 18 months and 30 months. Both developmental and autism screenings may be performed in intervals outside of the EPSDT preventive visits, only if they're medically indicated for an enrollee at risk for or with a suspected developmental abnormality. Next. Louisiana Medicaid's developmental and autism screenings. Louisiana Medicaid will only reimburse developmental and autism screenings administered during EPSDT preventive visits in accordance with the AAP Bright Futures periodicity schedule. Louisiana Medicaid also covers developmental and autism screenings performed by primary care physicians when administered at intervals outside of EPSDT preventive visits if they are medically indicated for a beneficiary at risk for or with this expected developmental abnormality. If an enrollee screens positive for a developmental or autism screening, the provider must give appropriate developmental health recommendations, refer the enrollee for additional evaluation, or both as clinically appropriate. Interperiodic screenings may be performed if they're medically necessary. The parent, guardian, and a medical provider or a qualified health, developmental, or education professional that comes into contact with the child outside of the formal healthcare system may request the interperiodic screening. These screenings can be billed if the beneficiary has received an age-appropriate preventive screening. If the preventive screening has not been performed, the provider is to bill the age-appropriate preventive screening. There is no limit on the frequency or number of medically necessary interperiodic screening or on the proximity to the previous screenings. Therefore, it is essential that providers document the following information in the beneficiary's record: the individual that requested the interperiodic screening, why the screening was requested, what was the concern, symptoms, or condition that led to the request, and the outcome of the screening, any diagnosis and or referrals resulting from the screening. Documentation must include all the components of the screening which were completed. Medically necessary laboratory, radiology, and other procedures may be performed and are to be billed separately. A well diagnosis is not required for this. Next slide, please. This slide shows some of the developmental screening tools which are approved by the AAP Bright Futures schedule. Next. In this slide shows some of the autism screening tools approved by the AAP Bright Futures schedule. Next slide. Next, we will speak about reimbursement. To receive reimbursement for autism and developmental screenings, providers must use age-appropriate, caregiver-completed, and validated screening tools as described by the AAP Bright Futures. Providers must document in the patient's record the screening tool used, the result of the screening, and any action taken if needed. Developmental and autism screenings are currently reimbursed using the same procedure code. Providers may only receive reimbursement for one developmental screening and one autism screening per date of service. To receive reimbursement for both services performed on the same day, providers may submit claims for 2 units of the relevant procedure code. To bill for a developmental or autism screening, the CPT code is 96110. This code has a $10 reimbursement. Please note that CPT codes and reimbursement codes are subject to change. Next slide. Now we will be speaking about perinatal depression screening. Next. Perinatal depression screenings can be billed from birth until the child makes 1 year old. The recommended screening times per the AAP Bright Futures are by 1 month, at 2 months, 4 months, and at 6 months of age. Next. Perinatal depression screenings administered to a beneficiary's caregiver in accordance to the AAP Bright Futures periodicity schedule is covered. The screening may be performed from birth to 1 year old during an EPSCT preventive visit, an interperiodic visit, or an office visit. This service is a recommended, but it is not a required component of the well child check. Next. This slide shows some of the screening tools that can be used for perinatal depression screenings, such as the EPDS, the PHQ-2, or if positive, a PHQ-9, or a provider can just choose to do a PHQ-9. Next slide. Louisiana Medicaid's perinatal depression screening. Documentation of a perinatal depression screening must include the tool used, the results, and any follow-up action. If a beneficiary's caregiver screens positive, the provider must refer the caregiver to available resources such as primary care provider, obstetrician, or mental health professional, and document the recommendations provided. If the screening indicates positive for suicide ideations, concern of the safety of the caregiver or the beneficiary, or another psychiatric emergency, then referral to emergency mental health is required. Next. Now we will speak about reimbursement on perinatal depression screening. Although the screening is performed to the caregiver, reimbursement for the service is under the child's Medicaid coverage. If 2 or more children under the age of 1 are present on the same day, such as twins, the provider must submit the claim only under one of the children. When performed on the same day as developmental, autism, or both, providers are to append modifier 59 to claims for perinatal depression screening. To bill for a perinatal depression screening, CPT code 96161 is to be used. This code has an $8.14 reimbursement. Also, again, please note that CPT codes and reimbursement codes are subject to change. Next slide. These are references that were used in order to make this PowerPoint. And we have come to the end of the little PowerPoint. If there are any questions and answers, please put them in the chat.
Thank you, Norma. I'm going to change the slide. So, you guys, if you want to access our developmental screening toolkit that will help to support and or implement any of these screenings that Norma spoke to, let me pull up the chat. There is a Q&A option, and I believe as well as the chat that if you have any questions that you would like to ask at this time, please go ahead and put that in. So we'll give you guys just a few minutes to do that, as well as utilize the QR code on your screen. Okay, I'm going to stop the sharing right now so that I can better see the Q&A option. So we're going to give you guys just a few minutes to do that. And as that time closes, I'm also going to put the website to the toolkit in the chat as well as the evaluation. Toolkit in the chat. Just a couple more minutes for questions and we'll get the evaluation in. Yes, I will pull that QR code up again. I'll also have the link in the chat, and I'll share that screen. Okay. Okay, so not seeing, okay, let me do that again. Thank you for that feedback. Okay, toolkit link. Hopefully you can see that now. And evaluation. Nope, those are both the evaluations. Okay. Goodness, technology today. Okay. The evaluation link is in the chat. You should be able to see that. I'm going to stop sharing one more time and see if I can get the toolkit in the chat. But as I do that, I want to thank you all for being here and attending this third session. Several of you guys have attended all three, and we appreciate that. You can always ask and request for additional training and coaching. Thank you. Someone got it in the chat for me. Thank you. I'm having technical difficulties. Um, you can reach out to us at the Bureau of Family Health at any time if you need additional support for elevating your developmental screening practices, your clinic workflow, whether it is from the beginning implementation or whether you're supporting those services. We again want to thank Norma for being here and providing us that information of how we utilize those Medicaid services. To help. Yes, we have a thank you in the chat. That billing code is, and that information is helpful. So at this time, we will conclude our webinar and reach out if you need anything or have any questions. Y'all have a good afternoon.